Good day, everyone. We're from IPL Group 12. My name is Nivna, and along with the rest of the group members, this is our team, we'll be presenting on our case today. So, what we'll be going through in our presentation today is number one, the introduction to our case, a brief clinical summary, and we'll be going through our visits to the patient's house. We'll be going through the summary and the problem listed, and then we'll be going through the management and discussion of the patient. And finally, we'll be going through the reflection and the conclusion of our case. So the first part would be introduction. So our patient name is Lai San Wan. He's a 80-year-old male. He's a retired labor. He was a pemeringkat kayu, which is a lumber grader. He is married and has two sons and one daughter. So a brief clinical summary on our patient. So basically, our patient was first admitted to HUKM in July 2023 because of ischemic heart disease, IHD, and idiopathic pulmonary fibrosis, IPF. He was discharged after 1 week. The morning after he was discharged from the hospital, his wife found him lying on the ground, unresponsive. Therefore, she called an ambulance from HUKM. At the hospital, the doctors performed the exact same steps and tests when he was initially admitted to the hospital. Finally, we discovered it was discovered that the uncle, our patient, had a perforated lung and had to rely on LTOT. So basically, a medical history on our patient. Our patient is diagnosed with ischemic heart disease, percutaneous coronary intervention to LAD, idiopathic fibrosis, where he is now relying on long-term oxygen therapy. He has hypertension, dyslipidemia, BPH, and vasomotor rhinitis. So medication info on our patient as shown on the screen. So basically, atorvastatin is for his dyslipidemia, clopidogrel is to prevent blood clot, cardiprine is for pain, perindopril is for his HTN, bisoprolol is also for his HTN, glycerin trinitrate is for his chest pain, to relieve his chest pain. Dutasteride, or what we call tamsulosin hydrochloride, is for his BPH, and finally omeprazole nasal spray is for his allergic reactions. The next part of our presentation will be going through the home and NGO visit. So I'll be explaining on the home visit since I was involved with the home visit, and later on the NGO visit, Akif would be explaining about it. So the home visit information. So let's talk about the living condition of our patient. So he just lives nearby from HUKM, which is in Taman Vida. His interior of the house, basically there's a bed in the living room for the patient to rest, and the patient have limited mobility, thus he lives in the living room itself. So the living room and basement, so there's no washroom at the first floor. The patient has to go to the basement in order to go to the washroom. So the patient usually moves with the help of his wife, which is his sole caregiver. First, we're going through the patient condition. So the patient condition, physically, the patient can walk from his bed to sofa to watch TV, but will show symptoms of SOB. And he is also dependent on oxygen support for 24/7, oxygen support 24/7. So how is he taking his medication? Basically, his wife, his sole caregiver, takes responsibility to make sure the patient takes the medicine on time. And due to this medication, the patient has complained about how he had difficulty swallowing the medicines and sometimes choke upon taking them. So the patient's state of mind. So the patient is able to speak English language clearly. He can understand and answer questions clearly. But the patient have a good adherence to medicines, but he said that he cannot see improvement in his health condition despite the abundance of medications that he's taking. So moving on to the patient's daily routine. So we extracted this information from the patient and his wife himself, the wife itself. So based on the meals of the patient eats 3 meals a day. Or most of the time, he will just eat porridge. His routine, his daily routine, his sedentary routine, the patient spends most of his time at home. He will just wake up, watch TV, eat, take medicine, and get back to sleep. So his family or neighbor, he basically lives with his wife, and his wife really takes care of the patient. That's why I said the patient sole caregiver is his wife. And his children are the ones who bring him to hospital for checkups. His younger brother is basically the emergency contact person, as he just lives next door to the patient. So next is NGO visit. I will pass the presentation to Akif.
Right, hello. Thank you, Nifna, for the brilliant presentation. My name is Amir Akif, and today I'll be elaborating regarding the non-government organization visit, NGO. Okay, so there was a lot of NGOs that we thought about of going, but ultimately we landed on Jabatan Kerja Sosial Perubatan at HCTM. It is an organization that was introduced into the government hospital since 1952. Each hospital has their own Jabatan Kerja Sosial Perubatan, and this is a different organization compared to Jabatan Kebajikan Masyarakat. Jabatan Kerja Sosial Perubatan, or JKSP, is basically to help improve the social function of the patient, including his family, so that the patient can become a productive and independent member of society in accordance with the limits of the patient's ability as a result of the disease experience. It also provides medical social work services in professional manner to help overcome the psychosocial problems of patient according to the needs and type of illness based on the concept of total patient care. So on top of us as doctors, pharmacists, and nurses, we treat the patient medically, but they help them in a psychosocial manner. Okay. Next slide, please. Right. So when we entered JKSP, we met with this pegawai, or we met with this staff, and his name is Rozaini bin Sabran, and he is actually a part of the unit of surgery in Jabatan Kerja Sosial Perubatan, and he has 19 years of experience in this field. So this is him. What is the role of Jabatan Kerja Sosial Perubatan? So it is, like I said before, it is different to the normal Jabatan Kebajikan Masyarakat because it is linked to Perubatan. It's linked to HCTM. So, like I said before, it provides psychosocial aid to only patients of HCTM. So, since our patient is a patient of HCTM, he has the rights to visit this NGO and seek aid. It also has this method called problem solving method, which basically means that the Jabatan identifies issues and resolves them with the collaboration of other NGOs. Actually, this patient, he has already requested aid late July of 2023, but due to him not handing over the necessary documents such as bank statements, income slip, and IC photocopy, Jabatan Kerja Sosial Perubatan was not able to proceed with the aid. And so what we learn from Encik Rosaini is that we can only suggest to the patient to move the bed area from the ground level to the basement level, since the toilet is at the basement level. Also, he suggested that if the patient were to follow through with the procedure, that he would negotiate with Hasil to pay the remaining RM 5K via installment. Also, he suggested that he would refer the patient to the respiratory clinic for a supporting referral letter for oxygen refill discount. And this would make sense when I explain the medical expenses later. So in the medical expenses for the patient, he has three things that he has to pay for. One, the first one is the non-formulary drugs, which costed him 10,302 ringgit per month, including tax, which is a big amount, as well as the PCI, which is 15,000, like I mentioned before, and the oxygen tank refill, which is RM 150 per tank refill 4 times a month, which is ultimately 600 ringgit. So we can see that the patient has lots of expenditures, lots of expenses. But JKSP, their job is not to give him money. They're not set up to provide money to the patient, but they're set up to help them reduce their spending. Like I said before, through referral letters to get discount on oxygen refill and to get monthly installments to pay off the 5,000 ringgit remaining fee for the PCI. Next, please. Additional information that's quite interesting to me from JKSP is that there is a specialized calculation method to calculate if the patient is eligible for the monetary aid. That is all for the NGO visit. Thank you very much.
Okay, so moving on to our fourth content of our presentation, which would be the summary and problem list. So basically, the patient lives in the living room. As I said before, patient lives in the living room and have to move to the basement floor to go to the toilet. The patient is dependent on oxygen support, LTOT, for 24/7. He gets assistance from his sole caregiver, his wife, and also his family, which is his children and his brother. He has difficulty swallowing medication, but the patient is intelligible. Um, the diet of the patient is healthy, but his lifestyle is sedentary, which most probably is caused by his limited mobility. So next, let's go through the problems list. So first, biologically, the patient has SOB. He has loss of appetite. He has loss of hair and voice problem due to the medication, the abundance of medication that he's taking. He has a reduced body balance and have a tendency of falling. So which was the cause of his second admission to HUCAM. So psychologically, he has difficulty in communication because when he talks for a long period of time, he gets shortness of breath, but he has a positive mindset. Socially, he has limited mobility basically. He cannot walk for a long distance due to his breathing difficulty, and his lifestyle is sedentary due to his limited mobility. So moving on to the fifth content of our presentation, which would be the management or the discussion on this biopsychosocial problems. So first is the ischemic heart disease. Due to IHD, the patient may experience physical limitations, which is true, fatigue, which is also true, and the need for ongoing medical interventions, which is all these are true, because he is basically experiencing all of these conditions. Next is idiopathic pulmonary fibrosis. The patient has impaired lung function, which can lead to SOB, and reduced exercise tolerance, which leads to his dependency on long oxygen therapy. So psychologically, what issues arise psychologically due to this patient's condition? So first, arising from his IHD itself and his IPF, idiopathic pulmonary fibrosis, the patient may face anxiety, depression, adjustment issues due to the chronicity and lifestyle changes. And he may also have fear and anxiety because the patient may have grappled with fear related to unpredictability of his condition, leading to heightened anxiety. So what are the issues that arise socially? So basically, in the family dynamics, the conditions faced by the patient, his chronic condition may influence family roles, responsibilities, and relationships because everyone is basically involved in the caregiving of this patient. And community interaction, basically the patient may experience social limitations which will impact his work, hobbies, or community engagement.
So thank you. So next we will go for the assessment. So we will assess and monitor patient vital sign, activity level, eating pattern, and sleeping pattern. And the next, nursing will improving respiration for the patient. So we will position the patient in the semi-forward position and provide oxygen therapy. And then next, we will promote rest, provide a comfortable position by lying on the side rather than supine. And lastly, we will improve nutritional status, which we encourage patient to do diet high in fruit and vegetable, and then refer to dietitian to get adequate nutritional support. For the first meta-analysis, activity intolerance related to imbalance between oxygen supply and demand as evidenced by fatigue. So the desired outcome is patient will be able to maintain an effective breathing in normal pattern by 1 month. So the management for the intervention to the patient, as a nurse, we will monitor patient vital sign, oxygen saturation level before, during, and after activity to ensure patient is remaining in a stable state throughout the activity. And the next, we will monitor and record client ability to tolerate before, during, and after activity to prevent the client from the being harmed if the activity was continued. And the next, we will assist and demonstrate the client with the control breathing technique, including pressing lips breathing and inspiratory muscle use to help the patient manage dyspnea during activity. And then lastly, we will provide emotional support and reassurance related to activity to alleviate anxiety related to activity intolerance. So the evaluation is the goal was met and the patient be able to maintain effective breathing patterns. We'll go to the multidisciplinary care for doctor side. Doctor will identify the problem faced by the patient by performing necessary physical examination for correct diagnosis. And then doctor will educate patient about the disease, maintain and improve safety and quality of patient care. And then we'll provide primary treatment for symptomatic treatment. And lastly, doctor will refer patient to rheumatologist in management of osteoporosis, nutritionist in management of dyslipidemia and hypertension and other multidisciplinary care. And for the nursing side, nursing will make sure the family member are well aware of patient medical condition and then help patient in relieving pain and discomfort, monitor and record vital sign by looking for the sign that can be deteriorate or improve. And then nursing will perform diagnostic tests and physical examination during patient visit, such as patient reflex. And then we will provide support and advice to the patient on the diagnosis. And lastly, nursing will educate the patient about the various medication condition, provide clear instruction on the management of sign and symptom. And then next, we will go for the pharmacist. Pharmacy will provide education and advice to the patient and family member on the dose and side effect of the medication prescribed. And then pharmacy will review and record the medication taken by the patient and check and record the medical history and allergic reaction of the patient to ensure the medication prescribed by the doctor is safe and suitable for the patient.
Doctors are also responsible for scheduling follow-up appointments, for assessing recovery, adjusting medication, and discussing lifestyle modifications. Doctors are also responsible for the idiopathic pulmonary fibrosis treatment, for the long-term oxygen therapy, and post-IPF EMV 101 trials. Doctors are also responsible for taking care of the hypertension and dyslipidemia.
All right, thank you, Aki. My name is Kang Lee. I'm going to present the ending part of this presentation, which are the reflection and conclusion. Next slide, please. So after we visit on the patient and NGO, we realize that we must try our best to improve cooperation with patient and NGOs so that the patient can receive the aid they need. This is because during the visit, we received some negative feedback from the patient about the arrangement and communication between the NGO and the patient. So this is where we need to do some improvement so that the patient and NGO can communicate well so that the patient can receive what he needs. And apart from that, this patient visit gives us an earlier experience of the real life situation, which help us understand how our role fits into this larger healthcare system. And also this collaboration enable enhanced communication and coordination among professions so that we can communication well with other professions so we can do well and provide a best medical care for the patients. And also we can gain exposure to different healthcare disciplines, broaden our understanding of various roles of the healthcare system. Conclusion, our patient face a lot of challenges in tackling his health issue. We have, so all of us from different professions, we must work as a team so that we can enhance the patient health condition and also we can provide the best for the patient. We can ensure our patient have a better medical service as the problem faced by the patient require people from different professions to solve them. Next. So here are some references which help us in the patient visit and also preparing the slides. So that's all from us. Thank you.